Hi there, Dr. Salvatore Maleka again here. In this video, what I would like to cover the Cavovarus or cavus foot type and what kind of symptoms you might be experiencing with this kind of foot type. I've seen many patients throughout my time in practice where they might have either outside of the foot pain, it could be on the bottom underneath what's called your fifth metatarsal base, otherwise known as the styloid process. And I can show you that, in the room, if you're watching this video before you come in. Other people might have calluses under the ball of their foot on the outside, like metatarsals 3, 4, and 5. I've seen that in the office. With the Cavovarus foot type, I have also seen pain on the outside of the heel. I've seen perineal tendon pain, which if you see my video on perineal tendon disorders, a lot of those disorders are actually pretty common in people who have a Cavovarus foot type. There might be other symptoms that somebody with a Cavovarus foot type might experience, such as anteromedial ankle pain, which is at the front of the ankle, but on the instep, and it's not at the back. It's not at the back of the ankle, which would be more in the area of a different tendon that can contribute to a flat foot. Neither here nor there. Those are some of the symptoms that someone might experience who has a Cavovarus foot type. So in this video, I did want to kind of go over symptomatology a little bit and what a patient might be experiencing, but what I really wanted to go over was treatment modalities, what one might expect. In the physical exam, I'll definitely be looking for ankle stability, how stable or unstable an ankle may be, and how that feels in my hands. I'll also be looking at whether Cavovarus foot type is either flexible or whether it's rigid, because that can have big implication on whether conservative treatment may be successful or may not be successful. So if your Cavovarus foot type is, let's say, for example, it is mild to moderate and flexible, then what one might expect for treatment methods to help alleviate ailment is a stretching program as well as an orthotic and pretty much, pain medications, but that's as needed. I'm not a huge fan of pain medications. I actually don't love to prescribe too many pain medications, as I believe a lot of these ailments can be treated without. In some instances, some people need them, and I'm more than happy to prescribe. However, with the Cavovarus foot type specifically, it's more of a biomechanical issue than it is an inflammatory issue, depending upon whether the perineal tendons are involved or if there's some sort of soft tissue impingement. Neither here nor there, orthotics need to be carefully chosen. I love foot scientific type 3 orthotics for this kind of condition. If the rear foot is flexible, custom-made orthotics can also be used as well, but they must have, this is a little bit over the patient's head maybe, but if I evaluate a Cavovarus foot and there is more rear foot deformity than forefoot, then the custom-made orthotic should have a valgus post with a first ray recess, and I can go into detail in the office with you about all of that, should that be necessary. However, if your deformity is more on the rigid side or more on the fixed side rather, and it is a severe deformity, conservative treatment may not really be of large benefit. It can always be tried prior to surgery should someone be hesitant to go through with surgery, and I think it would be normal to be hesitant to go through with surgery. However, surgical consideration, is definitely important because more severe and more fixed deformities are going to likely require surgery. I posted an article below. Please feel free to check it out. There's probably going to be a lot of medical jargon again. Don't let that bother you so much. If you have any questions, feel free to visit me in the office. And I wish you the best of luck with all endeavors and getting your Cavovarus foot type better if that's what you've been diagnosed with. Take care. Hope you have a wonderful day. Bye now.